how does one avoid miscarriage? Almost 1 in 6 pregnancies that are conceived naturally are destined to miscarry. The incidence of miscarriages with conceptions following a fertility treatment are higher and is between 10 to 35%. And this depends on a range of variables that can lead to a miscarriage. The reassuring aspects are that one miscarriage does not increase the risk of a subsequent miscarriage. It's generally taken as a random chance event. Even if you have had 2 miscarriages, majority of times, or almost 85% of the times, the woman should still be able to conceive, have an ongoing pregnancy, and have a take-home baby. Even more reassuringly, even if you have had 3 or more miscarriages, even in that situations, without any interventions, 50 to 60% of the patients may be able to achieve a pregnancy, an ongoing pregnancy, and a take-home baby. There are various factors that can lead to miscarriage, such as lifestyle factors of smoking, excessive alcohol consumption, caffeine consumption, stress, though it has not been directly linked, can also sometimes be playing some part towards a miscarriage. There are other simple measures, such as vitamin D deficiency has been associated with infertility and the failure of the implantation of the embryos. So this is a simple blood test that can be undertaken, and taking vitamin D supplements can correct some of the problem. On the same note, simple conditions again like thyroid gland dysfunction, underactive thyroid or overactive thyroid can also contribute towards miscarriage, and it can be easily treated by taking thyroid supplements for a couple of months, and that may help you have a successful pregnancy. However, if you have experienced probably 3 or more miscarriages, then in that case it may be worthwhile to speak to your GP and seek further advice or referral to a gynecologist to explore any potential reasons. If certain reasons are identified, taking some extra medicines such as aspirin or blood thinning injections might help you have an ongoing pregnancy and a live birth, especially if you've been diagnosed with antiphospholipid antibody syndrome. If you have had a miscarriage which was beyond 12 weeks, then in that case, seeing a gynecologist may be important because it might be related to anatomical disorders of the womb, such as cervical incompetence or presence of septum. With cervical incompetence, just putting in a cervical suture can majority of times take the pregnancy to term. So there are simple measures that can be done, but equally sometimes it's important that you seek the help at the right time rather than being anxious about going through a similar experience again. There is another important point to remember, that if you've been experiencing multiple miscarriages, then going and seeing a gynecologist may help you by undertaking some of the investigations, such as thrombophilia screen, undertaking genetic tests both for yourself and the male partner. Because there are certain conditions such as translocation, inversion of the chromosome. These are minor genetic errors in the genome. These are not significant enough to affect any other part of your health, but sometimes it can affect fertility or can lead to recurrent miscarriages. And we also know that the 60% of the miscarriages that happen at less than 12 weeks are genetic in nature. So therefore, it may be worthwhile to consider doing pre-implantation genetic screening, or PGS, or is also known as comprehensive chromosome screening, or CS. By doing PGS, yes, you will be advised to go through a procedure very similar to an IVF. You will have to take fertility drugs, undergo through the follicular development monitoring, egg collection, and before we replace the embryos, at the day 5 stage or the blastocyst stage, we will take few cells from the embryo, and the embryos will then be frozen. These cells will then be analyzed for the normality of the chromosome complement. And when in a couple of months' time you would start the treatment again, and we will then thaw the embryos that have been proven to be genetically normal and replace these embryos back into the womb with an aim to correct a genetic cause behind the repeated miscarriages. So that is one of the important interventions one can consider when managing or looking after patients with repeated miscarriages.